Hi, I'm Dr. Christy Osborne. This is my sister who's going to be our model today. We're actually getting her checked, but we figured we would record this. I've been having patients ask us to do this so that they can show people how we adjust and how what we do is different. So we're going to kind of run you through that. So over here we start with doing a leg length check to see if one leg is shorter than the other. When we do that face up, if they're not even, that can be a huge indication that the upper cervical spine is out of alignment. Thankfully, Casey's here nice and even today. Good, and then we'll have her sit up and swing her legs towards the wall there. And then we come up and do a scan on the neck, because what we're feeling for are inflamed nerves that are at the base of the skull here. So we'll come up on either side. And Casey's are negative. There's a negative scan. Those nerves are not inflamed. So her atlas is in, but what we're gonna do is I'm actually gonna get her set up like we were gonna adjust her atlas. We're not going to, but I'm gonna set it up so you guys can see what that is. So we've got Casey set up here. She's laying on her side. Again, we're not gonna get her adjusted, but I'm gonna set up like we were. So you just lay in a neutral position on your side here, and then we come in and make sure that everything is set up perfectly. All of this gets adjusted to the perfect angle as according to what you need based off of your films for how this atlas needs to be adjusted. And then this comes in. This doesn't actually have an impulse to it, so this does not move up and down. It has more of a percussive force. So you can hear that, but this actually isn't moving up and down. You'll feel a little bit of a vibration. And then what happens is this comes in right here behind the ear. And I'm not gonna put it all the way down, but typically we would. We lock it into place, and then we click that button, and then that is what moves that into place. And afterwards, you just sit on up here. You're being a great model. And then we scan and recheck everything again to make sure that that is cleared out. And then we bring you over to this table, and this is where we're gonna take a look at the rest of the spine. We do other leg checks and really neurological testing and reflexes with the spine to see what needs to be adjusted. We always compare that to what the x-rays are showing us of how to adjust that. So the body really shows us what needs to be adjusted, and then we're guided by the x-rays of how that needs to be adjusted. So again, we're gonna do some leg checks over here. This table brings you down and lowers you down so that your leg face down for us. You're in a neutral position when we're adjusting. This is the instrument that we use over here. So it does have an impulse compared to the other one, but I'm gonna turn it up. It's a really, really quick impulse. We do not turn it up that high when we're adjusting people. So you can see it's a really fast impulse, so we don't have to use as much force when we're adjusting because we're using the instrument instead of our hands. So we do stress tests. So we'll stress the joint in the direction that it may be subluxated or misaligned to, so that we can check and see if that needs to be adjusted or not. Her pelvis is in alignment, so we're gonna leave that alone. We did adjust L4 just a moment ago. And now we're gonna get into some testing that we're gonna do where you do different motions so we can see what needs to be adjusted. Hang this right hand off the side for me. Good, hang both hands off the side. So in that, hold her leg short, and that shows me it needs to be adjusted. Her x-rays confirm that needs to be adjusted on the left side, so that's what we're gonna do. Bring your arms up there. Right there. Good. Hang both hands off the side again. Perfect. Bring those back up, and then we will recheck again to see if that needs to be adjusted, if we did it correctly, and make sure that that cleared out. And that way we can check segments every single visit and really track really specifically how well somebody is holding their adjustments. And that helps us to know when you need to be back and to put the perfect care plan together for you. Turn your head to the right. Keep your head to the right and hang your right hand off the side. Bring it back up and turn back to the center. Good. Turn your head to the right, hang that right hand off the side again. Much better. Bring it back up, turn back to the center. Shrug both your shoulders up towards your ears. Back down, lift your head, look at the wall straight in front. Back down. Turn your head to the right. Pull your chin towards your shoulder. There it is. Back up. So then when we're adjusting up in the neck, we obviously adjust this down even lower. So it's not a whole lot of force we're using. But we'll come right in here. There we go. Awesome. Turn your head to the right and pull that chin down towards your shoulder again. There we go. Back up there. And then we'll just bring the patient up so they stay in a neutral position here. And this table actually brings them up. So that comes up under the toes and raises them up like that.